Hey, I'm Emily. I work at WakeMed Rehab on 3C. That's their spinal injury, pediatric, adult, and whatever else they want to throw at us rehab. You name it, we help you get better from it. Um, I am currently involved on the 3C Unit Council, and I'm also chair of the 3C Work Life Committee, and I am on the system wide Work Life Committee for WakeMed. A couple of career goals. One is to kind of get out of the current job that I'm at. I want to eventually, long term, maybe get into women's health, labor and delivery, postpartum, that area of nursing. Um, I had a bad experience at one of my former employers and a good experience with management at my current unit. My other place I worked at, the management knew that the environment was very cliquey. The nurses were eating their young. They didn't really do a whole lot to stop it. Didn't really offer a whole lot of help, especially to new nurses. And when we parted ways, the manager half-heartedly looked at the HR representative to see if there were any other job openings, and they just said, "Nope, bye." Just kind of dismissive. Um, my other good experience was with my former manager at my current job. I had a patient one day who was we were sent out to ICU and he was in full isolation. She was in there dressed to the nines, hair and makeup intact, not like mine here. Um, and she, in heels and a blue dress, was dressed in a yellow gown and helped me push the patient to ICU. And that to me is like the epitome of what a leader should be, somebody who's willing to serve and never forgets what it's like to be in the frontline position, on the nursing unit, on the floor, taking care of patients. And my current manager also does a good job of that. She's very, how can I help you? Um, Things like that. And I just feel like if you want to be a great leader, you have to remember what it's like to serve and remember what it was like in those days where you were the nurse taking care of 4 or 5 patients who's really sick, just barely getting by, asking for help. Just remember what you needed and what you wanted, and then turn around and be that way with your staff. Um, don't be behind a desk, which the last 2 managers I had are not like that, which is great. And that's it.